We are now on the second demonstration for today, and what I would like to do is to show you further range of things that you can do, and you can start really tomorrow, as soon as tomorrow, when you're having some people coming, some volunteers, and please don't wait. Don't wait until you know, but use your volunteers to know better, in a way, okay? So we start where our client is lying this way, and just as a nice welcome, you can just put your hands on their body. And really listen to start with. We're such bound to do that we really want to start to just take the towel and start massaging. Sometimes just a moment of listening may cause few things, and I want you to help me. What do you think the effect of me just laying my hands here
Secure.
may do? Sorry?
Secure
Secure.
for the person who.
So they feel secure. Yes, they feel secure, definitely.
They're getting to know their touch rather than you just go straight into it.
Exactly. Getting to know their touch, or they know my touch, yeah.
And getting them to feel.
Sorry?
Connectedness.
Connectedness, yeah. So they feel they connect to you.
You can feel if they're a bit nervous, so if their heart's racing a bit too much, if it's their first time.
You can feel a lot more about them. Yeah. You can feel if they're nervous. How can you do that? What do you need to really observe?
Breath.
The breath. Breathing. Breathing is really the gate for our emotional state. So if we're calm, if we're all right, breathing would be really cyclical. Nice cycle, really slow. And if not, you feel someone breathing, you know where they are, and you can slow down or speed up. Great. So you can do that for a few minutes. There is no pressure involved. And this technique, it's a technique we called hold, or energetic hold. And at the beginning, for a long time, I thought that you call it because you hold your hands. But I find out that really, the real reason for this technique is that you need to hold yourself. Therapist. You hold yourself from start doing things and interrupting, doing things like putting pressure, doing things like moving, doing things like, it will come. Yeah, for now, just really observe the minute and really get the feel for what they are, what they need. But also, you teach them how to be sensitive. Massage is not an abusive treatment of just giving lots of deep tissue. Yes, you can do deep tissue, but also teach them how to listen to their body. Yeah, quite important. Then you're coming down. You may take the towel and do it like that, but it becomes quite thick here and messy. So what I would like you to do is coming from below and drag the towel down. And then you're tucking the towel here. And now you are ready. Good. To start with, you can put 2 times free movement with nothing, and then really slowly bring your hands. And the first move, always really, really slow.
Is there pressure?
Not much. So what do you think this effect?
Relax.
Relax them?
Confidence.
Relax me as well? How does it relax them?
Stimulate the parasympathetic nervous system.
Whoa, 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 whoa. What was that? Simple. Simple words here.
Just calms you down.
Yeah.
Slows your heart rate. Sorry.
Maybe, so from touching them, what's going on next? Okay, you touch them, they feel the movement. What happened next? How can they relax?
It's a bit warming, isn't it?
Warming, okay.
Trusting, they trust what you're doing.
Okay.
Your confidence.
But what happened from the touch? Where the touch needs to register?
It's the nervous system, isn't it?
Yeah, something in the brain. So it needs to come from the skin to the brain. And then the brain has to kind of say, okay, that feels good. I may just slow down. Good. So the brain, you talk to the brain, yeah? And there are many different ways to do that. You can put, you see, two hands, one on top of another. You can have two hands, one side by side. You can have alternating hands. You can come to the side. And you can travel to the other side while you're still moving your hands. You can do it with moving side to side. You can work with a bit of a jazzy way, you know, like dancing jazz. So you're really stretching your side. You can move up and down to the arms even, and then connect it back. So there is really a lot of creativity you can put in. It doesn't have to be army style exercise, yeah? You can even take it to the forearms a little bit. Yeah? But few things are similar. Quality, no rushing, not this, yeah? Easy with your body. Speed, quite slow, yeah? But I would like you to come very closely and observe something further. Do you see what happened to this area? What can you describe to what? Sorry?
You're pushing the blood.
I'm pushing the blood. Do you see that?
Mm-hmm.
So you are moving the circulation with it. If I'll do that quick enough and warm this area, do you start seeing the color here that it becomes red? Mm-hmm. Yeah. If I'll do that quite a lot more, well, not quite a lot more, but in a few minutes, then this area would become red. What does it mean, red?
More blood.
More blood. More blood circulation coming to the surface, improved. So, so one of the things that we're doing, we improve the circulation. Now, what do I mean by improving the circulation? We take some old blood and moving it, so new blood comes around from other areas. Yeah. This is particularly right in the limbs, that the movement goes in very predictable way. Here, the circulation moves a little bit that way. So one way of doing it is as well to the side, upward and to the side. So, yeah, so relaxing, improving circulation, improving blood, yeah, spreading the oil. Yeah, so this technique called effleurage. The name is in French, and it's part of the Swedish techniques. So effleurage, yeah, we'll give you some handout, and you have the video to see how to pronounce and how to write it. So we started with a hold, then we did the effleurage. Now we want to go a little bit deeper. Now for that, I would like you, before doing it, I want you to feel where the spine is. So the spine goes up and down, right? I would like you to go side to side and feel where the spine is. And then on the side of the spine, these are two long muscles, and I want you to feel these. Then, after that, when you feel the muscles, you know where to go. So you can start by trying to move the muscles as much as you can. So the first technique was hold, just hold. Second one is superficial. Now you want to move the muscles underneath as much as you can. So you can do it with few position in your hands. You can do it with the base of your wrist into the muscle, and then you actually need to push with your knee. So you push it with your knee, and then your hand goes. It's not that moving your body, but it's actually moving your knee. Remember, use your weight as much as you can. So there is a lot of sinking into it. Yeah? Do you see the link to the knee here? Quite important. So I'm actually dropping my weight that way. And then you need to find another place and drop your weight. So there is nothing I do with my spine. Nothing I do with my hip. It's really the knees that progress me forward. Okay? So that's the first one, base of the wrist. And you need to do it slowly. Oh, by the way, quadratus, yeah, your group, our group, yeah, is the muscle that is in the lower back here. It will be interesting to look. It's kind of a shy muscle. It hides behind another muscle. So would be interesting for you to see it. The second moving the tissue technique is with the base, with the fingertips. Yeah. So you need to establish a contact with the tip of the with your tip of the fingers into the muscles. But usually what I find that one hand is not enough. So I do a reinforced hand. So within that, I use the base of my wrist as a base, and then I cup it a little bit. So I precipitate the forces here. If I would do it flat, all the forces would spread all over. So I need to precipitate here. I do that. And then again, quite small area. You can do it in circles this way, circles the other way. But the most important thing is that you can't do remember the effleurage, hold back? You can't do it now. Because you're working deeper, you need to work in smaller sections. And you need to go and feel in a sensation that's called palpation. What I'm doing, I not only do, I also feel. Where is it? Okay, that feels tight. Okay, let's go and see the other area. Yeah, okay. So there is like a search that I do with my fingers. I can't look. Where are you? It's under the skin. You can't see it really. So you need really to feel. And sometimes I even look somewhere else to concentrate on the palpation. Yeah, okay. It's like when you need to see something, you close your eyes to just have the image. Yeah. Good. So we do the deeper work with the base of the wrist, with the fingers, and you can do also with the knuckles a little bit. Okay? Again, what I would like you to appreciate it, and I'm saying it because I see everybody's looking at my hand. I want you to observe the full movement that happened here. Between me and that, there is nothing move. It's more the knee, the both knee moving. Yeah. Don't do too deep. You would learn slowly how to work deep enough. So start with the movement, okay? So just as a revise, hold, effleurage gliding, and then the pétrissage. This is the technique I'll show you with a deeper work. Yeah?